Hey, it's Dr. Kate Walker. Welcome to Step It Up Special Training. I'm super excited because I am going to talk to Vanessa Hillis, and they are a Hipaa risk assessor. And I'm going to refer to her as a...
sorry, Kate, my pronouns are they, them. So just reminder.
Thank you so much. They are a Hipaa risk assessor, and I have been referring to them as a Hipaa auditor. So we are going to learn so much about Hipaa today, and they've actually constructed their presentation just for us. It's going to be geared toward counselors, mental health professionals, new professionals in the field. In fact, I asked them to please take out all the stuff that would pertain to hospitals and big organizations and things like that. And they're going to talk about it for us. And I'm so pleased that they agreed to do this. Vanessa, thank you so much for coming. And I can't wait to hear all the stuff you have to tell us.
Great. Yeah. Thank you so much, Kate. I'm very excited to be here. And thank you for this opportunity to share my knowledge with the world. That is one of my favorite things. Ooh, my autofocus. We're all in this world now, right? It'll come back. Okay, so I'm going to go ahead, since my autofocus isn't working, I'm going to go ahead and share my screen and do my, it came back, and start my production, my slideshow for you guys.
I'm going to make you co-host. Hold on, here we go.
Oh, great, thanks.
Boom.
Awesome. Okay, so again, reminder, I'm Vanessa Hillis. I work with They, Them Consulting, and my pronouns are they, them, theirs. Okay, let's share screen. Great. So today's presentation is about Hipaa risk assessment, the purpose and benefits, and I'm going to do a little intro about who I am and what I'm going to talk about, and then we're going to go over a Hipaa overview and some details specific to mental health practitioners. And then we're going to get to the real fun stuff and talk about breaches, audits, and penalties. And then we'll jump into risk assessment. So we'll follow it up or wrap it back up with risk assessment, and then how you can improve your compliance and prevent these breaches, etc. So I am going to go ahead. Let's see. So this is my beautiful logo. I work with a company called Cyber Compass. So They, Them Consulting is founded and owned by me. I am a trans non-binary person, and I'm based here in Central Texas. I work with a team of trans and LGBT and allies and members of the community. And we're a safe space for LGBTQIA clients and consultants, and not just LGBTQIA clients, but that's like, our niche. And we specialize specifically in small practices and nonprofit organizations. So these groups that are often neglected by vendors and by people like me. Because I understand, I've worked in nonprofits, and I understand how difficult it is to find someone who really gets the price point and gets the budget restrictions around what it means to be a small business I run a small business, I get it. So, but yeah, we offer hard skills like Hipaa consulting and operations and cybersecurity and project management. I have a team member who does marketing and web design, et cetera, et cetera. So I partner with a local to Central Texas web developer who created a tool called Cyber Compass. And this Cyber Compass tool allows me to conduct these Hipaa risk assessments at a really fast, much faster and cheaper and easier for you guys than if I were just, going off of my own internal knowledge and pen and paper, or however people used to do it.
Well, and that's one of the things, Vanessa, we're gonna leave this presentation understanding why this is necessary, because
yes.
You and I, when we talked about doing this presentation, I mentioned that a lot of folks watching this are going to be surprised that they even need to do this.
Yeah,
right?
Yeah, and it's like a basic, it's like a core, it's a big deal. You're supposed to do it every year. So, but we'll get into that. But yeah, so this tool is basically like TurboTax, but for compliance. So it's automated, has all of the Hipaa information in it. It can walk you through self-assessment, or you can use it with an assessor, which I'll talk about the differences in those two things. But this isn't the only tool like this out there. It's just the only tool like this that I use and that has me with it. So yeah, so this is a great tool anyway. It has a lot of great features, blah, blah, blah. Anyway, moving past this, I'm sure I should be paying more attention to this very important tool, but it's fine. We'll move on and talk about this fun stuff. Okay, let's talk about Hipaa. I know.
Yay.
I know people get, it's most people's least favorite subject. It's one of my favorite subjects. I love regulations and rules and compliance. And I love that what I do gives me the opportunity to get to know a bunch of different businesses and organizations and people. And using the framework of HIPAA regulations, it helps me help you do better work and feel more confident about your cybersecurity position and your compliance position.
I just thought of something. Vanessa,
sure.
Are you going to give us a way to contact you at the end of this presentation?
I am. Yes, I've got a slide with my email on it, and I'm going to also say, go to this website to get this free download, blah, blah, blah. And there'll be a link, and hopefully can we put a link in the thing?
Oh, yes, we can.
I figured we could. Okay, cool. Great. Okay, cool. So let's talk about HIPAA. Okay, we're going to the basics. So HIPAA stands for the Health Insurance Portability and Accountability Act of 1996. It is a set of national standards to protect sensitive patient health information from being disclosed without the patient's consent or knowledge, as well as the preservation of and accessibility of these records. So this is administered at the federal level by the Office of Civil Rights, which signals that this is ultimately in place as a focus on patients' rights. This is here to protect patients, protect their information, make sure that they have access to their information, and yeah, protect people. So at local levels, it's administered and enforced by the Health and Human Services statewide or at the state level, which we will look at. Okay, so HIPAA has two main components. It's the Security Rule and High-Tech Act, which is what we're talking about mostly today, because that's where it addresses technological concerns and EPHI and electronic health records. And the Security Rule and High-Tech Act is where the assessment mandate comes in, which we'll talk about. And then there's the original HIPAA. HIPAA original was just the privacy rule, and it focused on confidentiality and disclosure. And then in 2006, they introduced the security rule, or that's when it became effective. And that applies to electronic information. It was like, hey, the internet exists. We should update our rules. And so they did. And that is that slide. Now let's talk about the HIPAA safeguard areas. So there are three, when looking at HIPAA as a whole, what HIPAA is concerned with are three main safeguard areas. So they're checking to make sure it takes a real holistic approach. HIPAA is a very expansive regulation. It takes a holistic approach to your organization's safety and security. So they want to know about your administrative and operational safeguards. So that includes things like written policies and procedures, communicated policies and procedures. This is where training comes in, staff training comes in. They want to know what you do, how you do it, and where people learn how to do what they're doing. So they want to see the paperwork. If it's not in writing with HIPAA, it doesn't count. So they also focus a lot on technological. That's the part that people are most afraid of, I think. That's the part that people are most intimidated by, the technological requirements, and that's password strength and firewalls and cybersecurity and computer updates, etc. And we'll talk about that. And then the physical safeguards, which are all pretty obvious, like you need to have locks on your doors and windows and some sort of security system. And but it also considers things like where's your monitor pointing, the physical positioning of monitors and physical location of filing cabinets and where shredders are located and where the to be shredded boxes are located, and etc. So it cares about the physical elements as well. So when you go through a HIPAA risk assessment, a lot of questions start to feel really repetitive because it'll ask basically the same thing about each of the safeguard areas. It'll say, how do you lock this door? How do you lock your computer? Et cetera, et cetera. So those are the three main safeguard areas. It's a very expansive, wide breadth of a regulation. And let's talk more specifically about the cybersecurity element, which is the scariest part for people. But really, HIPAA's cybersecurity rules are written very loosely or vaguely to request or to require general basic cybersecurity. The HIPAA cybersecurity rules and best practices are no different than general cybersecurity best practices. There are extra elements regarding specific PHI rules, but it all comes down to this general concept that is known in cybersecurity as the Cia Triad, which has nothing to do with the Central Intelligence Agency, but it's just what it's called because it stands for C for confidentiality. So you want to make sure access is limited to only approved parties. So you only want the appropriate people to see the information, right? The I is integrity. So integrity in this sense stands for or means that the information should be protected from unauthorized destruction or alteration. So you're thinking of the integrity of the information itself. The information should stay as it is. And then 3A is the availability. So records should be accessible when needed. Part of HIPAA's rules say that patients should have access to their records as requested, and they should be able to transfer them to other care providers as requested, so that a doctor can't hold patients' files, hostage, rather than transferring their care to someone else. And that patients are allowed to see their own records and see what's going on. So those records have to be available. And so sometimes availability and integrity can get like a little conflated, because if something's destroyed, it's no longer available. But there are a lot of other ways things can become unavailable and inaccessible. If you think about ransomware attacks, where a cyber hacker comes in and puts a wall between you and your records and says you don't have access to them anymore, the records may still be confidential. They may still be perfectly without alteration, but you don't have access to them. Or if they exist on a hard drive that lives in somebody's house and that person doesn't work for you anymore, or if they are in a storage facility that you somehow lose access to. There are a lot of ways that you can lose access to these records. So these are things, the confidentiality, integrity, and availability. That Cia Triad is just a general cybersecurity model, and that at the root is what HIPAA is focused on.
Vanessa, I want to ask you before I forget, availability is very pertinent for many of us right now, because we have a system that's going out of business, and they are a HIPAA compliant file storage system that many of us have used. So I just wanted to put that out there, because I know you'll talk about it more later. What happens when these folks are like, hey, you've got 30 days to decrypt everything, and right?
Yeah, that's a quagmire. That's not great. Yeah. Okay, cool. We'll address that we can talk about that more in detail if I don't cover it, which I don't think I'm really specifically covering that, but we have a little midway question break that we'll talk about that in. Yeah, that's not great. I don't love the idea of having to switch things. 30 days is such a short amount of time. Okay. So now let's talk about the specific HIPAA rules around healthcare, mental health care. So mental health care information is classified as especially sensitive health information. And the sensitive information includes things such as domestic violence information, mental health, and substance abuse. So these are things that we all probably interact with, or not me, but y'all interact with in the course of your practice. And this sensitive information is information that poses an unusually high risk to the patient in the event of disclosure. So if mental health information gets released about someone, they have the possibility of suffering discrimination, social stigma, and physical harm in the case of domestic violence information. So HIPAA requires particular care and attention with sensitive health information. It expects sensitive health information to be really, really protected. They really, really don't want you to leak that or it to get lost. And so you will, as mental health care providers, you will be held to a very high standard of security of protecting your patients' files. And as we all want to do, we all are here, we all care about these people and their records and their privacy. And we all want to protect them. So, let's make it better. Let's make it easier. Okay, and then specific psychotherapy notes requirements. So HIPAA classifies psychotherapy notes separately. They have separate special requirements and exceptions and rules. So first of all, a psychotherapy note per HIPAA, per the federal government, is a note recorded in any capacity on any medium by a mental health professional about the contents of a conversation during a counseling session. So this is group counseling, family counseling, solo counseling, the notes you're taking about that specific session. So this is distinguished from what would be considered the health record, which is things such as medication history, appointment frequency, diagnoses, anything that wouldn't be reported to insurance for billing or would be transitionable to another treatment provider in the course of treatment. The psychotherapy notes, if kept separate from the health record, are treated special, and they have special rules. If they're kept with the health record, they just count as health record. So you have to be sure to keep those separate if you'd like to treat them special. So the special rules around these psychotherapy notes mean that they're basically double extra protected. So there are certain types of health information that you're allowed to transfer to other care providers in the course of treatment. So without even, potentially without even the patient's explicit consent as a way of helping improve treatment. And there are certain types of information that general disclosures will cover if the patient would like, a partner or a family member to attend a session with them, or if they'd like certain elements of their care shared with that person. But something that exists within those psychotherapy notes requires to be shared with anyone outside of that to share it with anyone. It has to be, it has to have its own special individual authorization form. So there are more stringent rules around making it explicit that the patient explicitly wants these psychotherapy notes shared in this capacity. And they also, so we talked about that availability rule of that patients are allowed need to have access to their files, right? So the medical file that y'all have follows under that rule, but these psychotherapy notes have special exemptions to where you can, at your discretion, withhold these files from a patient if you feel they would be harmful to the patient or could cause harm to others if the patient sees them. So there are a lot of nuances that are specific to the healthcare industry. Okay. All right. And then sole practitioners. So, all right. Most of you all are sole practitioners or work in really small practices, or possibly a lot of you are new to the field or new to practice. And HIPAA is extremely intimidating, as is IT security for most people, reasonably, because it's complicated and it's scary because there's all these rules and penalties and people in there to assess your compliance and auditors and but it's you still have to do it. Even sole practitioners are required to comply with HIPAA standards if they transmit payment or treatment information electronically. So you might be like, oh, I don't take insurance, I don't have to do it. You still do, most likely. There's a very, very, very small chance that you do not transmit things electronically, but if you don't now, then you probably will in the future. And as soon as you do, you are suddenly supposed to be compliant with HIPAA. So if you aren't currently a covered entity or required to comply with HIPAA, you should still follow the HIPAA guidelines, because at any point your situation may change, and then that gets triggered immediately. You don't get a grace period to become compliant after you start accepting transactions, et cetera. So
I want to mention here, one of the things that I teach folks is House Bill 300. House Bill 300 is a state law that mimics HIPAA in every way. And then we also have explicitly in our licensure law, it mentions HIPAA standards.
yes.
So anybody out there who thinks they're going to slide through I'm not a covered entity loophole.
No.
Nope. Okay.
Yeah. The Texas, so Cyber Compass specifically measures HIPAA compliance and talks about HIPAA, but so that's why I've distinguished that. But there is the state level Texas Medical Privacy Act, which removes the caveat about treatment information or electronic, and says anyone collecting PHI has to follow HIPAA. So if you're in Texas, and most states have something like this, but no matter what, it's in your best interest to comply with these rules, because not only to prevent yourself from getting penalized, but also to protect your information and to protect your patient's information. And that's really what we're here for. The good news, sorry, maybe I should have opened with good news. The good news is, even though you have to follow the HIPAA rules, you have to be compliant with HIPAA, there is a lot of flexibility built into the regulation, because it's one set of regulations that covers you and also that huge hospital down the street. It's the same base set of regulations. And so HIPAA doesn't expect, the Health and Human Services doesn't expect you to do the same things and spend the same amount of money or even percentage of your budget on HIPAA compliance as it does for huge hospital systems. They use a term that often they say reasonable and appropriate. They expect you to scale your HIPAA compliance practices to what is reasonable and appropriate to your organization. So there are several elements of HIPAA that have a lot of wiggle room. There are a few that are pretty specific, but there is a way to do it that is within your budget and within the scope of your org that makes sense for you. Okay, all right. Breaches, audits, and penalties. This is the fun. It's not fun. This is not fun. This is what we're trying to avoid. All right, let's start first and just, what is a breach? We've all heard breach. A breach is an unauthorized use, access, or disclosure of this protected health information. So it can be deliberate and malicious or unintentional. Doesn't really matter. If a breach occurs, it's still a big deal. It's still your problem. So you still have to deal with it. And the common sources of breach, most people, when they think of a breach, they think of a data breach, they think of hackers. They think of the black screen with the green letters and someone type, they think of the movie Hackers. Anyone remember that? But that's fairly rare to be specifically targeted. You're more likely to be experience a breach as a result of a larger software insecurity or from user error slash accidental. So so let's give some more specific examples of that. So software insecurities, there have been some recent popular stories about Microsoft Exchange servers getting compromised over the last, in 2021, and who knows, time is bizarre these days, but over the last couple of years, Microsoft has experienced several major cybersecurity flaws, and effectively that means that a hacker isn't just trying to hack you, they've hacked a larger system that you also use. Like these compliant, HIPAA compliant softwares. That's one of the reasons why it's so important to pick a good software, a HIPAA compliant software for things like data collection, et cetera. But a hacker will attack the whole software, and then they don't just have access to you, they have access to the thousands or millions of users of that software. So you may think, I'm a little fish, no one's looking for me. They are, and they also catch you from other things. And also, you may think, I'm a little fish, no one's thinking of me, but they might, because health records are very valuable on the black market. something like if a credit card number is only worth like $1 on the dark web, but a medical record is worth thousands or hundreds. I could be wrong, but a lot more than $1, because there's so much more information in there and you can do so much more with it, especially things if depending on the type of clientele you have as well. But then this user error / accident. So user error, if you have a system in place but you're not using it properly, and that results in a breach, that's very common, as well as, you know, just not locking your door, or not using the tools you have in place, or not being aware of some of the risks that you're engaging in. So we'll talk a little more about risks, or we'll talk a lot more about risks later. But yeah, so that's what a breach is. And Hipaa has a breach notification rule. So it's within Hipaa, it says that if once you're aware of a breach of your information, or reasonably should have been aware of a breach, which means you can't just ignore, you can't just not pay attention, because you're obligated to know about what's going on with your systems and your data. And so once you're aware of these things, you have 60 days, depending on the scale of the breach, to notify all affected patients of the breach, notify Health and Human Services, and notify local media. If more than 500 people have been affected, you have to notify local media. So it's going to become part of public knowledge. And then you also have to launch an investigation and conduct a new risk assessment right away in response to the known breach. So it's a really big deal when you have a data breach. There's a lot that happens, and you need to know this process. That's one of the things people often don't know, is that there's a process that you're supposed to undertake when you have a known breach. But yeah, the breach notification rule. Okay, so a breach is the most likely thing to trigger an audit of your org. So audits are conducted by Health and Human Services, or they can be called for by your state attorneys general. Texas doesn't have a very strong enforcement arm of the TMPA, so you're more likely to get something triggered by HHS than by Texas. But that's not better. still an audit. So you'll be audited by Health and Human Services, and while your chances of randomly being selected, they do a random selection each year based on surveys and scale, et cetera. Your random audit rate chances are very low, but if you experience a breach and report a breach, which you should report breaches that you experience, your chances of being audited are almost 100%. You're almost certainly going to be audited in response to your breach. And what happens during an audit, you can have, they can be digital audits, or they can be what they call desktop audits. So they can come into your place in person, or they can send you a letter and accompanying emails, and they can request digital transfers of files. And they're going to want all of your written policies and procedures. They're going to want your past 6 years of Hipaa records, including past risk assessment documentation. And those are required every single year, which we'll talk more about. But they want everything, and they're going to look at all of that. And based on that, and based on the breach itself, and based on the violations you have and the cause of the breach, they're very, very likely to result in penalties for any violations they find. And so let's take a second and say, no one's 100% compliant. No one is. There's no real way to be 100% safe and secure. It's like with cybersecurity, a 100% secure computer is unplugged, and doesn't have a battery, because you're constantly engaging with risks as part of what you do, and as part of this business, and a part of our lives. So the goal is it's not really to be 100%. The goal is to be as secure as you can be, and to consistently be considering and striving for compliance. So you don't need to, you're not going to have the same things in place that the big hospitals have, but you need to have record that you are aware of your risk and compliance position, and working on it, and in that constant process of I am working on it. I am trying. We are really trying to be compliant. You need to show that effort because these auditors have quite a lot of discretion in the way they classify these violations and the way they implement penalties. So let's talk about penalties and violations. So the penalties for these violations, and again, violations could be deliberate or unintentional. Doesn't really matter. They're still a violation. They can be monetary fines, which I have a whole slide about. Employee sanctions, which means you can, staff members could be fired or demoted. There can be civil charges and criminal charges. So depending on the violation and the cause and the type, it can be anywhere from a year in jail to 10 years in jail. But that's if you're like a criminal. So don't be criminals. But even like lower level tier 1 violations, which have no, like you didn't know the violation was happening and you had reasonable cause not to know, you could still face jail time for that because you still should know. It's still your responsibility. This is your information. It's your responsibility to protect your patients. And then
I'm going to insert here just because I know
sure.
a lot of counselors are quaking right now.
Oh, okay, great.
You're going to talk to us about how this yearly annual audit, personal audit, self-audit is one of the ways you show that you know and you're aware, right?
Yeah, yes. This is my strategy. I scare you and then I tell you how to not be scared.
Perfect. Because we're all like engrossed right now. Yes.
Great. That's the way I wanted it to be. Okay. So now let's look at financial penalties. These are fun too. So even the bare minimum of a violation penalty is $120 per day of violation. And that's for the low level ones, up to 1.8 million for these willful neglect violations. So small sole practices are very unlikely to be fined at the highest level because you have so many fewer patients. But even the little ones, still a lot. We don't want $30,000 in penalties for something that we can easily avoid. But again, the auditors have a lot of discretion in how they classify things and how they implement penalties. Every breach and every audit does not result in a penalty. Every violation does not result in a penalty. There is room for discretion, the auditor's discretion, if they like you. No, if you have the things in place that you should be doing, if you're doing what you should be doing, but a breach happens anyway, because that's kind of what happened. Like, that's just, you can't control everything, right? If you're doing what you should be doing and a breach happens anyway, you aren't certain to be penalized. You have to be able to show that you are doing what you're supposed to be doing, that you're really trying. You have to show the effort. You have to show that you're working towards compliance, or your heart's in the right place. Okay, so because we just covered a lot of stuff, I wanted to pause in the middle to give myself a breather break, and also to see if there's any questions about breaches, violations, penalties, or about Hipaa as a regulation on the whole. And bearing in mind that the next section we're going to talk about is the risk assessment, requirement, process, what it looks like, what you're supposed to get from it, and some ways to improve compliance. So let's not ask questions about that yet, but let's talk about the other stuff.
Okay. You've talked about two different kinds of information, PHI and sensitive information.
Yes.
And so just, can you kind of clarify that for us?
Yeah. So PHI in general is just protected health information, and it's synonymous with ePHI, which just means electronic protected health information. So any medical information collected by a provider is PHI. Everything collected by counselors and mental health care professionals is sensitive. So everything you collect is especially sensitive, I say especially, it's sensitive information and is held to a higher standard. So you all as counselors, as mental health providers, are held to a higher standard than the podiatrist down the street, within the scope and scale of your org, within what is appropriate and reasonable. But that information needs to be extra protected.
Mm-hmm. Now, and I know you'll probably cover this in a minute. BAAs, which types of software, the difference between like using I know we don't have these anymore, right? Phones with cords, what constitute some of us still do. What constitutes something that's holding PHI versus something that's not holding PHI? I think that's where a lot of mental health small businesses. So I get you're going to probably cover all of that BAA stuff later, but
that's a really good question. And I'm actually not planning. I don't have a section really digging deep into BAAs. But so BAA is a business associate agreement. So that, let's say you have an office and you have a cleaning company who comes in and they come into your space and they clean around the desks, and the desks have PHI on them. So those people have access to PHI. That's a simple example of a business associate. So you need an agreement in place with that business associate, ensuring that they are HIPAA compliant as well. You're HIPAA compliant, your associates who have access to your HIPAA or to your PHI are also required to be compliant. And when it comes to small businesses, most of your vendor relationships are digital. They're Google G Suites and Simple Practice and these different online tools. And there are online agreements in place. You just have to figure out how to get to them. But most of them have a BAA that you can request. You just have to specifically request it from the settings and have those on file somewhere and keep track of them. And for these big, Google and Microsoft companies, there's really not anything we can do about the VA they have in place. We just trust it and move on. And if there's a violation if there's a breach as a result of one of these organizations, your organization's probably not going to be held accountable for that. But when it comes to smaller orgs, if you're working, let's say, with a cleaning company, you are required to make sure that they really are HIPAA compliant as well. Like, you have to have a BAA on file for that vendor, and they have to be HIPAA compliant. And you're supposed to ask every year, hey, are you still HIPAA compliant? And the amount of effort you put into that ask and tell relationship is really contingent on how much access they have and how big your organization is. But you should have an annual review as part of your risk assessment. You should have an annual review of all of these BAAs to make sure that they are current and they haven't expired, just to have them on file. And so some of these softwares, there are certain online tools you can use to check the HIPAA compliance of different electronic health record systems. Usually those are so electronic health record systems specifically are have a special category, or they get special attention from HHS. But things like Google don't have that, even though you may be using a tool that isn't a specific EHR to save data, so you won't be able to check the HIPAA compliance of those tools. But so that's all stuff that, when you get into the assessment, the software or an assessor can help you with. It's the nitty gritty,
And that's something small business owners like myself, we try to find I'll speak for me then. I try to find the one-off, right? So and that's what happened with this particular software. I happened to check my spam one day and they said, hey, this is your 10th warning. We're going out of business. You have 30 days to decrypt everything. It's like I mentioned earlier. So they had given me more warning, but that's just, they're going, so they weren't able to really help decrypt. So that's something that, for those of us who can't or don't get the big robust software that we might find at that link, because you gave me that link and I checked it and I was like, oh no, I don't find this here.
Nothing's in there. Yeah, it's really, that tool is really more applicable to bigger clinics and hospital settings, because they can afford the bigger softwares, the EHRs that are EHRs and that are regulated or that are monitored by HHS. But so there's a little bit more effort that you have to put in as the sole proprietor with everything, right?
Yeah. All right. Well, I think the rest of it you covered what happens if PHI is breached?
Mhm.
Is a HIPAA audit required?
It's not an audit is not a required. It's something that randomly happens or usually happens in response to a breach.
And then,
But it's triggered by someone else. You're not triggering it. You're not asking for an audit.
and that self study, what are we calling that again? When we just kind of audit ourselves.
Oh, I'll talk about that in the next
Perfect.
thing. Yeah.
All right. Well, I'm caught up.
Okay, great. All right, let's move forward. Risk assessment. Okay, risk assessment. We've been talking about risk assessment this whole time, I hinted at the beginning and then we stopped talking about it. What HIPAA requires every covered entity perform a risk assessment after every major change of the organization or at least annually. So that means if in 6 months you move to a new office space, that counts as a major change and you should do another risk assessment. The scale and scope of that risk assessment is going to vary greatly depending on the size of your organization and the size of the change. It can be, but a formal process needs to take place and documented that shows that you have evaluated your risks, because evaluating your risks and assessing them is really the only way to know what's going on with your organization and where your vulnerabilities are and to strengthen them and to be a strong, secure organization. So this is directly from the HIPAA regulation. I'm not going to read it verbatim, but it references the Cia Triad. Great. So let's talk about what is risk. This is a somewhat complex concept. When you really dig into it, it's a function of the likelihood of a given threat triggering or exploiting a particular vulnerability and the resulting impact on the organization. So risk is not a single factor or event, it's rather a combination of factors or events, these threats and vulnerabilities that, if they occur, may have an impact on your organization. So vulnerabilities and threats. So vulnerability is a flaw or weakness in your system that could be exercised, which IT lingo, or not lingo speak, is accidentally triggered or intentionally exploited and result in a security breach. And a threat is the potential for a person or system to trigger one of these vulnerabilities. So this probably didn't clear anything up for anyone. So I've created a beautiful analogy because I love to solidify concepts with concrete analogies. This is fun. All right, let's understand risk as in the example analogy related to dogs. We all love dogs, right? Okay, so in this analogy, the vulnerability is that your backyard gate is open. The threat is that your dog, who's in your yard, will go through the gate and leave your yard and run free in the world. The risk here is calculated by how much of an impact your dog escaping your yard would have and the likelihood of the dog going through the open gate, which dogs, 100% that dog is going to go through that gate, right? But the impact of that on your day is going to depend greatly on the type of dog you have, whether he's kind of just going to go on his route and come back, or if he's going to dig in the neighbor's garden, or if he's going to run straight into the road. And it depends on the neighborhood you're in and the municipality, and it has a lot of external factors, and whether you work from home or you work far away, do you have to drive back to get your dog? It's a whole ordeal, right? And it's very complicated. The ultimate risk is complicated and by these exterior factors. There's a lot of factors involved, right? So during a risk assessment, I or you or somebody goes through your organization and they identify these vulnerabilities, these open gates, and they identify these threats, these dogs waiting to run out, and we suggest solutions such as, oh, okay, your gate is broken. It's not just open, it's broken, so we need to fix it. Or your system in place around closing the gate is not adequate. We need a better system to close the gate. Or something, or a malicious actor came and opened the gate, so we need to put a lock on the gate. There's a lot of different ways to solve for different vulnerabilities depending on the specifics of the vulnerabilities, the specifics of the threat, and the specifics of your situation. So so the purpose of an assessment is just to find all these risks to PHI or EPHI and to identify specific problems and to find specific solutions. And a reminder, this is mandated. Every covered entity is supposed to do some form of risk assessment every year, every single year. And you have to keep record of it, because if you get audited, they're going to look for those records. Okay, so what's a risk assessment? How do we do it, right? It's a vague concept of what it is. It's pretty straightforward, and there's a lot of different ways you can do it. You can do what I consider a fully self-assessment. So you're working on your own, evaluating your own risk. The Health and Human Services website has resources available that are, a free, very, very not great tool to help you assess your risk. And there are spreadsheets and forms you can use. And you can do this by yourself if you want to, if you need to, if you're small enough, if you don't have a budget, if you work alone, if you have a lot of time, you can definitely do this on your own. It is doable and it is allowed. The negatives of self-assessment are obvious. It's hard to give yourself, and it's hard to be objective with your own org, and you're not an IT security expert and you're not a Hipaa security expert. So you're not going to know what to ask, and it's sometimes the way they phrase certain questions or the way the certain regulations are written, it's confusing even for people who are experts. So and that judgment, the figuring out the discretion of what really makes sense for my org. Do I really have to do this thing? It can be complicated, and that's difficult. So if you don't have that time, if you don't have the mental bandwidth to do that, you can do something that I call a supported self-assessment. So that's using a third-party software like CyberCompass, the tool I work with, to assess your risk. So there are several out there. I'm not only talking about mine, even though I'm biased because I use it and I like it a lot, but CyberCompass is great. So let's say you're using a tool like CyberCompass. You give the tool your organization's information. It asks how many people work there, etc. And then it walks you through a step-by-step process of, asking you these certain questions. You answer them. Based on the way you answer, it gives you a quantitative score of your risk, and it auto-generates a list of your specific risks, prioritized by how high of a risk they are to your org, with specific remediations, right? So it gives you that list of what to fix and in what order, right? It also gives you a generated report, which shows a snapshot in time of your risk compliance position, which is something you keep on file to give to an auditor if you are audited. And then you keep track of you can use the tool as a project management tool. Usually they're a 1-year license. With CyberCompass, it's a 1-year license. You have access to the tool to use it as a project management tool to track those remediations, which is also super helpful if you get audited, because showing your progress is one of the biggest thing. So if you start out with a score of 20% and you get to a score of 40, that's a huge deal. The numbers themselves aren't super meaningful because, anytime you quantify, but the improvement and the being able to track your improvement is super helpful and important in the case of an audit, and also in the case of just strengthening your org. These tools also usually have things. CyberCompass has a training module, so you can handle your staff training right in there and track your staff training, track completion. And you can also they usually, and CyberCompass they will generate policies and procedures for you. So the documentation part of the policies and procedures is taken care of immediately by using one of these tools. So that's super duper helpful. And these are very approachable price points depending on your org. Usually something like this could cost less than $2,000. And this is March 2022. I'm just spitballing here, but it's not, I know 2,000 is a lot for a small business. I'm a small business, but it's not 10,000. It's not, and I said less than 2,000. So anyway.
Well, I'm thinking right now, if you are a big practice owner, and I'm talking if you employ 3 people, if you have 3 therapists, you can afford this. Like you can't afford not to do this.
Yeah, really. Yeah. If you have 3 staff, like if you have staff at all, you should not be doing a self-assessment because it's complicated. It's difficult. So if you have staff, there's a lot more going on there, and there's a lot more at stake than doing it alone can do. So something like this self-supported self-assessment, you're working alone, but you still have access to the software resources, and you'd have access to me as a technical guide. Like I help people with these as well. So I'm just not as involved with them, but because it's self-assessment still. But so then the third type of assessment, and this is for if you're a larger org, let's say you have 10 staff or more, or 50 or 500. If you are a larger organization, or if you've experienced a recent breach, or if you just want extra support, if you just want someone there to hold your hand through it and talk you through things, you can do a managed assessment, which is everything you get with a self-assessment. You get the software, but you also get a person. And to my knowledge, CyberCompass is the only local cybersecurity or HIPAA security compliance software that has in-person people. All of the others are located in other states, so you can get the supported self-assessment, but you can't get someone to come to your office and look underneath the keyboards to see who's hiding passwords. But yeah, so the managed assessment, you get a person you get an audit, you get an assessor, you get an outside brain who can think about your unique organization and guide you through things. And if you're a really small org, sometimes groups will do a managed assessment the first year, and then they'll do self-assessments following, or the supported self-assessments, because they can kind of handle it more themselves after learning the process. But the most important thing is doing an annual assessment, keeping record of it, and having those records on hand as needed. So the time is running. This is taking a long time. So I'm going to go quickly through this part because it's not as important and it's easy to understand. So there are some general project phases that happen with any risk assessment project. There's the discovery phase, where we gather information about your org, all of your current policies. We investigate things and we interview staff and inspect facilities. That's the fun part. And then there's the analysis phase, where the assessor or the tool crunches all the numbers and decides this is what the highest risk is, this is what your compliance position score is, etc. And then the results delivery phase, which is where the report gets written / generated, which is a snapshot in time of your current position, and then where your general recommendations are made about how to improve your situation, and then the prioritized remediation. So that risk register gets generated during that results delivery phase, and you take that and you go and you remediate risk and improve your compliance and strengthen your safety and security. And so that is what happens during that. It's pretty self-explanatory. Okay, so this is the fun part. Now we're at the real fun part. Improving your compliance, right? So I'm going to go over a few basics here, and I also have a downloadable document about simple ways to improve your cybersecurity if you're for small businesses like us. And you just go to my website and you can download that there. There will be a link in the description of this event to that, or you can just go to my website. But so the first thing you're going to do to improve your compliance is do a risk assessment, create a risk management plan, start remediating risks. So if you do this risk assessment, really the only way for it to really help your org is if you use it to decrease your risks or to improve your situation. So you need to have this remediation process, this compliance process, is an ongoing process of identifying specific risks or risk behaviors, implementing solutions, and monitoring and evaluating the effectiveness of those solutions. So the ultimate goal, make yourself stronger. But it's an ongoing, what's important, it's an ongoing process. It's not, you're never done. It's a process. Okay, and in my experience as a risk assessor, I've come across several common HIPAA violations that are pretty pervasive across all scales of organizations. There will be, the first is a lack of annual staff training, or not documenting annual staff training, or the staff training is not super great, so it's not really helping. The second is not having full written documented policies and procedures. So that's pretty common, extremely common. I've never actually met an org who has everything in writing that they're supposed to have in writing, because if it's not in writing, it doesn't count. Not having a risk management plan, because that's important. And most people aren't doing, or I mean, I guess not most people, a lot of clients don't do regular risk assessments. And so you can't have a risk management plan unless you've been doing risk assessments. And then in the same vein, having documentation of your known deficiencies. As I stated before, HHS and HIPAA auditors, they don't really, it's not super relevant if you are unaware of something that you should have been aware of. You can't, ignorance is not bliss. It's not an excuse. If there's something you should have known, if you had been doing your due diligence, then that's what counts, not that you didn't know. It's some people are afraid to conduct assessments because they think, well, if I know about it, I have to do something. And that's not accurate. Even if you don't know, you're supposed to know, because it's your obligation and responsibility to know. And then the last thing that is a common violation in HIPAA is the rule of least necessary access. So in general, HIPAA has a rule about when sharing PHI, you should use the least necessary, you should share the least necessary, lowest necessary amount of information, right? If you only need to share the name, you just share the name, you don't also give them the full medical record, right? And internally, operationally, a lot of organizations who have more than one staff member don't have any they don't have any distinction between different people of who gets access to what. And not everyone needs access to everything there's no org where every person needs access to every piece of PHI or every element of PHI. So having some sort of distinction in place is very important. Okay, and then similarly, there are some common risky behaviors that I see that can lead to breaches that some of them aren't explicit violations of HIPAA rules, but they are violations of cybersecurity best practices. So often, if you're using insurance portals to process PHI payments, a lot of times you'll have a shared login that everyone uses the same login info for that website, or for that. Maybe you can't afford 2 copies of this license for this software, so you share the username and login info with a coworker. That's a vulnerability. That's a risky behavior. Using simple, repeated, or shared passwords. I know everyone always talks about password strength, but it's super duper helpful. And lack of awareness of common risks like phishing. There's a lot of simple things that you just have to constantly you have to always be afraid of cybersecurity. If you're not a little bit afraid of your security position, then you're not paying attention, because even like there's no 100% secure. So you should be aware of and thinking about and considering, just like you are with privacy and confidentiality, you should be aware of the need for confidentiality, aware of the need for security in all computer related things. Another risky behavior is not having those not keeping record of your current BAAs, the business associate agreements, or not checking to make sure they actually are compliant BAAs. There's certain language that needs to be included in them. And like I said, for big things like Google and Microsoft, those are probably going to be good. But the one you have with your cleaning company, who I assume is a small business just like us, you're going to need to look at it a little more closely. Or maybe you're the one who's issuing it, so your language is already in there. And then the last one is a physical security risk, building access not properly being controlled or tracked. So, anytime a visitor comes into your space, you need to be tracking it via a visitor log. There needs to be documentation of who is coming and going. And if there is a key or a code to the building, if somebody leaves the practice, then the keys need to be changed so that person doesn't have access anymore. There's a lot of just specifics around that are often overlooked. Just operational processes around onboarding and offboarding that are easy to overlook. Okay, so this is my last slide, and I like to end on reminding people about the compliance mindset, which is, all successful organizations, all successful compliant organizations really make compliance part of their company culture. It's not just a thing you do. It's not just the taxes you do once a year, which is how I do my tax. I don't think about them the rest of the time. I just do them and then move on. It's a part of your daily operations. It's a part of the way you think about things. Is this compliant? Is this safe? Is this secure? And because it's not an endpoint, you're never finished being compliant. You're never going to be done. You're constantly working on it. You're constantly doing it. It's a part of what you're doing, But yeah, so that's I strive to have the compliance mindset. I encourage you all to have the compliance mindset. We'll have another moment for questions, but I want to land on this slide just so you can see my website info. Again, you can go there for a downloadable 3-phase plan to building blocks for your cybersecurity situation. It covers things like ways to improve password strength, and solves a lot of, helps encourage solutions to a lot of those risky behaviors I called out, and can hopefully just help you improve your security position, but also improve your confidence around your security and your compliance position, because that's important. You want to be a little afraid, but you don't want to be, terrified. You want to be, like you want to have a healthy respect for it, like you do with snakes or something, or spiders. You shouldn't be terrified, but you should keep your distance, right? Like that with
That's
cybersecurity.
literally going to be the tagline for this presentation. It's kind of like snakes and spiders.
Yeah,
Hipaa.
you should have a healthy respect, not a phobia. We don't need to be phobic. Yeah. Okay, cool. So do we have any questions? Do you want to ask any questions about this part
I think
of it?
what I'll do, I tell you what, let me do this.
Mm-hmm.
Thank you so much for this presentation. I want to invite everyone to feel free to contact Vanessa about this presentation. It is so important. Thank you again for presenting and offering us your knowledge. Thank you, thank you, thank you.
Oh, thank you so much. It's been so great to be here and to be with y'all. Yeah, I hope to hear from you guys. I love making new friends. And this is a delight.